Hi, I'm Attorney Ramsey Bahrawy, and this is Your Money, Your Life. Today our topic is positively and effectively interacting with a loved one while living with serious memory loss, confusion, and language difficulties, which have been diagnosed as dementia. In this segment, my guest is Mal Allard. She's a registered nurse and founder of a company called Their Real World. In addition, she's the director of the Courtyard at Uville Place. Mal Allard specializes in the daily care and communication challenges of people living with dementia. Also, as we like to do on this program, she stresses the importance of education. Mal, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you for inviting me, Ramsey.
Now, let's start with what is Alzheimer's? You know, you hear this all the time. Somebody will have a difficult time recalling a word or recalling a name, and they'll call it a senior moment. Is it actually a senior moment?
I think sometimes it may be. I think it takes a little bit more time to retrieve information the older we get, but many times it's not simply a senior moment. When people see the senior moments increasing on a regular basis, then it's time to go for a checkup and try to find out a diagnosis for these symptoms of dementia.
What sort of symptoms, to use your term, should people be looking for before they go for the so-called checkup?
Well, what you're seeing within yourself probably, as well as your family members who are closest to you, is that you are becoming more forgetful. You might forget that you have a doctor's appointment, where forgetting the time perhaps or the date is more common, that you totally forget that you have a doctor's appointment. Perhaps you're getting lost driving or walking in your neighborhood. Having a little bit of trouble sequencing things, working with the checkbooks, things like that. There are definitely changes.
All right. Now, can somebody who has been diagnosed with Alzheimer's disease, can that person continue to live safely alone at home?
It depends on what stage they're in. A lot of times, if it's early stage, the earliest stages, if they went to the doctor sooner than what many will, it is safe for them to continue to live at home, providing that someone is keeping an eye on them, communicating with them, a caregiver who's close and really knows what's going on. Someone who will know the changes and recognize.
Is there any particular way for a caregiver who's dealing with a loved one who's living at home alone and has been diagnosed with dementia, is there any particular way that they ought to be communicating with their loved one?
I think it's knowing what their normal is. And when they see changes in what their normal life and routine used to be, they see changes in that, you know, there could be further problems. Like if the loved one cooks quite a bit, you know, you're looking out for safety and things like that. Are they still driving, which is not recommended most of the time anyway, even with early stages of Alzheimer's disease. So it's the frequent phone calls, but don't just call. Typically on the phone they will answer almost everything the same questions, same answers. You want to physically see your loved one. You want to spend a few hours with them on a regular basis, because that's when you see if there are enough changes that might cause a red flag. Do we need some help in here? Do we need to change something?
What kind of changes would cause this red flag that you mentioned?
Well, as they progress within the disease, it depends again on what their normal is. So if you know that they cook, they heat things up in the microwave, do they have little burns on their hands? Are you seeing little pink marks? When you got to the house even, was the door left unlocked? And you know they always lock the door. Is the water running in the sink? Are you noticing in the refrigerator that the food is outdated or there's not enough food in there? Are they wearing the same outfit on this visit as they had on the last visit and the one before? Do they seem unkempt? Are they not doing things they usually do? Are they not going to church or not going out to the store? Different things like that.
Okay, so if these red flags that you just mentioned, if they exist, what does the family caregiver or our family members in general, what should they be doing when they see these red flags?
I think that they need a total assessment, you know, have someone come into the home. If it's still the thought that they're to live alone in their own home, how much longer would they be able to do that successfully? You know, if they're self-isolating, how do you get them out of the house? You know, how do you keep them engaged? So you're going to make some choices as to what do we do next. They're living home alone. Do they need home care to come in? You know, do they need companionship? Do they need help with cooking? Do they need help with bathing or housekeeping? Do they need someone to take them out to be more sociable? Being a companion for them and with them, is that enough for them? Do they need adult day care? Would they benefit for that? That 2, 3, 4 days a week they're gone for most of the day, so they don't have to cook. They're getting their meals there, a little breakfast and a lunch. Is it time that they move on to assisted living? So there's a lot of options. The biggest thing for the caregiver, the family members and loved ones, is to educate themselves. Be in touch with Elder Services, the Alzheimer's Association, Minuteman Senior Services, whatever is in their area, to get an assessment, what is necessary to make their life more optimal, whether they remain at home with help or whether they transition to another location.
Is it true that a person who lives with Alzheimer's, because they recognize that their life has become different, do they become frustrated, and because of that frustration, does their personality change? Is that true?
It is true. It is true, but I think that we need to put ourselves in their shoes. If all of a sudden we realized that we were becoming a little bit more forgetful, and I believe that people from 50 years of age and on, anytime we do forget something, we kind of think that, you know, is this normal? Is this okay? If I were to receive an Alzheimer's or a related dementia diagnosis, I would be afraid. I would be angry. I would be frightened. I would be frustrated. I would be anxious. It's the same way for the caregiver receiving that same news. You go through a grieving process. And the more things that are taken away, such as driving or cooking, woodworking, whatever it might be, there's just so many no's and so many changes that I believe most people are very overwhelmed in that. It seems like a lot of things are taken away, and the caregivers and the loved ones need to give something back. So if they can't drive any longer, maybe they could drive them, you know, to some of the places that they used to go on a regular basis. But they take away the car, they take away the cooking. It's difficult for them. It's difficult.
Well, I mean, my personal view is you can't isolate somebody, so you can't expect them to stay in their house or condominium or apartment or whatever the case may be, not be able to go anywhere, not be able, as you said, be able to cook, not be able to do anything. So there has to be a plan for these people. Okay, when they need a ride, we need to figure out how to get them a ride so they can go places. We need to make sure that if they can't cook, that there's a way to get food for them. You know, there has to be a plan in place, and that's where I think the family has to pitch in. They really have to work together on this. But anyway, it's easier said than done, isn't it?
Well, it is. There's a lot of people that I've assessed over the years, and perhaps they have 5, 6, 7 children. And what you'll typically see is the same 1, 2, or 3 people are the ones that will really get most of that work done and most of the organizing. It's important to give as many people who are willing to be involved their own job, so that they feel like they're helping within the care, within this dementia journey with their loved one. It's difficult to arrange it all, but I think they're not used to having the family meeting. And when you're caring for someone with dementia, schedule family meetings, get together, you know, see where your loved one is at that point, who's doing what. Is it still okay that you're doing the shopping? Is it still okay that you're bringing mom to the hairdresser? Can you do 2 nights a week for 3 or 4 hours instead of 1 night a week? And I've been involved in several of these family meetings. And they all do come around in one way or another, but they too are frustrated and upset. You know, this is a whole new journey for them. And when it's someone you love, it's really difficult.
If you were in one of these family meetings and the person diagnosed with Alzheimer's, what form of dementia, is resistant to not only not cooking and not going shopping and not driving, but is resistant to the diagnosis itself. No, I'm fine. How do you talk to that person?
It's really, really difficult. What I do is, as soon as I sit down with someone to assess them, I might fuss around looking for a paper or something and tell them, sometimes I'm a little bit forgetful these days. And a lot of times they'll kind of nod their head and say, me too. If I can get on that side of them, and it's private and we're talking, they open up a lot more. They do let me know their frustrations, but you will find other people that will just adamantly refuse to admit that they know that they're forgetful. And a lot of times they cover constantly in the very, very beginning. They're not sure if there's something wrong, so they cover and they cover and they cover. And I think if the family members get in on it earlier, instead of talking about their forgetful loved one behind their back, did you see dad did this or mom did that, they already know, the mom or the dad already knows that there's something wrong. So as soon as the family start to see these things, if they're offering their support, I think, Ramsey, at an earlier date, as opposed to the later date when they're really still, the loved one is covering very, very well now. So I think before it gets to that point that they're trying to cover very well, it might be easier for them to accept it a little bit better.
Now, isn't this whole issue of diagnosing somebody with dementia, isn't that made much more confusing if you've got somebody who's taking prescription medication and you have somebody who perhaps is abusing alcohol, perhaps abusing the prescription medication, also suffering from depression? Isn't that all confused?
Well, it is all confused, but that's where the person would start out at their primary care physician. That's when medications are reviews, all the simple things, you know, whether they do vital signs and lab work and a recent history with the person who knows that person the best, who sees them the most. So if both go, then the doctors could figure out on the medications, is something not working right anymore, or if the family suspects that maybe they are using alcohol too much. It does complicate things. But then again, excuse me, the person with memory impairment, depending on how far along they are, I could say, you know, you already had 2 drinks, perhaps you shouldn't have another one, and they can adamantly deny that they had any at all because they have forgotten. So that too, and the difficulty in that is where they actually are at that time within their dementia symptoms, within their disease. You know, one thing really runs off the other.
Okay. Now, in terms of a caregiver who's a family member communicating with the person living with Alzheimer's, is tone of voice important? Is showing or not showing your frustration important? Is being patient important? Or is none of it important?
Every single thing of it is important.
Every single
or
one.
Every single thing. You know, are you talking to them like they're childish? Are you talking to them and they're perceiving it that you're saying they're inept? Are you sounding bossy? You know, are you sounding demanding? Are you polite? Are you using those good manners? You know, are you talking to this person like you've talked to them all your life, or has that changed? A lot of things change with communication. You have to watch not just the tone of your voice and what you're saying and how you're saying it. You need to make sure it's not all that complicated. Keep it simple and watch a facial expression, which is huge in communication, as well as your body language. So if you're kind of watching everything that you're doing, not that you're watching, you're very aware, and you're, again, putting yourself in their shoes. How do I want someone to talk with me if I'm confused, if I'm forgetful? Well, I want you to talk to me like me. And that's what we need to continue to do with them, even as they progress within the dementia.
Okay. So tone of voice is really quite important.
It's very important.
Is it important to also do some demonstrating, you know, because sometimes people don't quite catch on to what they hear? So
Yes.
is it important to sort of demonstrate for them so they can see what you mean?
Well, it is. Sometimes they're not understanding your words, even if you're saying, come over to the table, it's time to eat. So if they kind of look at you and you're not sure that you understand, that they understood your words, you could just say, come on over, it's time to eat. So you're going to use facial expression, watch your body language or be aware of it. You can cue them with hand signals, even simple little things like the bathroom. You can, if you're not sure that they understand which door it is they're to go in. We use arrows, pictures of the toilet, a sign that might say bathroom, bedroom. Some people will take a picture of the clothes in the closet and hang the picture, you know, if there's several doors around. It's all cueing and wayfinding.
Okay.
Yeah.
So the visual is really important.
The visual is really important so long as the loved one does not overdo it. So I went into a kitchen one time and they had a sticky on every single cabinet with with what was in the cabinet. So the effort was there and the effort was good and the idea is good, but you want to keep it to what they use the most perhaps in the kitchen or what you already know they're having difficulty locating, because too much of anything is too much and they're not going to read them after a while.
In communicating with a person living with Alzheimer's, is there a role that humor can play?
If you don't find the humor, no one will have a successful journey.
No.
So sometimes the loved ones don't understand and they think that you're making fun, or others perhaps laugh too much in front of them with things. But you do need to find the humor, and just because someone has dementia does not mean that they don't have a sense of humor. And they can laugh at their own forgetfulness sometimes. A lot of it depends on how the caregiver is, what the rapport is with the caregiver. But I know my mother-in-law died several years ago of multi-infarct dementia, and some of the things that she did during the journey, in the moment perhaps was not funny, but when you're talking on the phone with other supportive relatives, you laugh, and even years later after she died, it's like, do you remember when Ma did this?
Right.
So yeah.
You know, I taped a show, it's a little over a year now, with a gentleman who was diagnosed with early stage Alzheimer's. And one of the difficulties for him was the fact that when he would go into social settings, people stopped talking to him. They would talk to his wife to talk to him. What's that all about?
Well, I asked a doctor that once. The same thing happened to me. I brought a lady with dementia into an emergency room. And the doctor, I wasn't even related to this lady, number one. And this doctor looked at me and told me what he thought. He told me this whole story. I had already stopped listening because I'm thinking Myrtle is right beside me. And so I kept looking at her, trying to keep her as part of it. And he says, well, what do you think? And I said to the doctor, I think perhaps you should speak with Myrtle about these things. You know, so, and he looked like he was embarrassed. He realized what he had done. I think it depends on the setting and why people stop talking. But I believe that people should always be involved. But it's up to the person. If you take the person to the very large Thanksgiving family, you know, event, and they seem comfortable with all of these people and the stimulation going on, then you did well that year, and you will try it again next year. But if it didn't go well this year and they want to go home and they want to go home, people aren't talking with them, they don't know what to say, then you need to be prepared for that as well. If it's a family event, and someone, especially in middle stages of an Alzheimer's type diagnosis, the family member should be prepared. Even if you call the Alzheimer's Association and asked for their basics of Alzheimer's, it's a little booklet, they'll send it to you free. But the family members need to know a little bit about the disease and speak with the closest caregivers, like, you know, talk to mom about this, talk to dad about this, or whoever it is. I think that we're setting sometimes the family members and friends up for failure because they don't know what to do and they don't want to do or say anything wrong. So we need to let them know.
What do you mean we're setting them up for failure?
We should be telling them, you know, Dad is coming this year as always, but he's much more confused. He can't go with the flow of the same conversation anymore. You know, maybe send them a little booklet about Alzheimer's, or even email, create a letter that, you know, Dad likes to talk about this. He finds this difficult. He doesn't remember people's names. You know, don't ask him a lot of questions like, who am I? And a lot of people will do that. They feel like it's the third degree, and they'll become, the person with dementia will become frustrated very early on. So we need to make it failure-free for them.
Now, I've read and I've actually heard from family members that people diagnosed with Alzheimer's can exhibit aggressive behavior. Why do they exhibit aggressive behavior, and how should a family member respond to that aggressive behavior?
I think most of the time the aggressive behavior is because we're not communicating effectively with that person. People typically do not become angry. You know, there's a build-up to it. So we need to figure out what happened beforehand that caused this person to go from maybe a little anxious or a little bit agitated to being aggressive. Again, it's the communication. If you're saying no to this person who has memory loss, or you're asking them questions that they don't know the answers to, if you're explaining things to them in great detail, why they can't do this or what you're doing today, if you're saying no to them, you can't go to work because you don't work, well, that's going to make them feel more confused, become more anxious, they get agitated, and if you're constantly telling them the same things over and over that they already don't want to hear, some of them will get aggressive. So we're learning how to validate the way that they feel. We're learning to recognize that we have to enter their world. What year do they think it is? How old do they think they are? Where do they think they live? How are they perceiving their space right now? Where are they in this current moment right now? And that's where we need to communicate with them. You know, we're not going to waste time arguing. You know, you're not in your 50s, you're in your 80s. You don't live in Maine. You have not been in Maine for 60 years. That makes them feel inept, and they'll argue with you, they'll get defensive, because in their world, that's where they think they are.
Okay.
Okay.
So it's a matter of their perception, what they're perceiving, what they're seeing, what they're feeling.
Yeah. In that time, and our response to that. And if we're always arguing with them, or trying to tell them the way that it is in our real world right now, they're not understanding that. And we need to know when to step back a little bit, you know, accept the disease. You know, it's not a happy time when you learn you have one of these memory impairing illnesses, and we all grieve for a time. But the family members and friends at some point have to say, this is what we have. This is what we have to live with. How do we do this together successfully, happily, and finding the humor within it as well?
Let's talk about a subject that it applies to really everybody, but specifically let's talk about people who may be having Alzheimer's. How important is it for them to get their affairs in order, in other words, to plan?
It's very, very, very important, because you see a lot of dynamics amongst the siblings and the family members sometimes. One truly believes that mom wants this, and the other just as equally believes that mom would have wanted this. As soon as people are seeing symptoms that aren't going away, the forgetfulness is increasing, you really want to get the person to the doctor. You want to get a full workup done, right through to the neurologist, to see what type of dementia might this loved one have. I want to make my own decisions. I have 4 children, and perhaps they may think, you know, this one's healthcare proxy, this one's POA, and maybe it's not going to be who they think it might be. Maybe I want things that they're not certain of right now.
Sure.
Absolutely. As soon as they think there's something wrong, run to the doctors, find out, and get your legal issues in place.
Good advice.
Yep.
Great place for us to stop.
Okay.
Today we learned that Alzheimer's disease is the most common form of dementia. It is a progressive disease that slowly destroys a person's memory, judgment, and functionality. Just like the rest of our bodies, as we age, our brains change. Although we all notice some occasional age-related slow thinking and memory loss, serious memory loss, confusion, language difficulties, and other major changes are not a normal part of aging. Such difficulties, in fact, may be a sign of Alzheimer's disease. My guest, Mal Allard, shared with us that effective communication with a person living with Alzheimer's requires patience, understanding, and good listening skills. Decreasing the stress of both the caregiver and the person living with Alzheimer's is crucial. To do so, it is recommended to speak slowly, clearly, and with a calm voice. Use short, simple words and sentences. Be patient and understanding. Don't rush. Don't show annoyance. Avoid criticizing or correcting. Adjusting your behavior in these ways will likely establish a positive pattern of communication leading to a reduction of stress, anger, and conflict. Less conflict evokes more happiness. More happiness results in better caregiving. In other words, the goal in all communications with a person living with Alzheimer's disease should be to connect in a positive, constructive, and effective way. Don't overlook the power of touch. By incorporating gentle touch in your communication, you may find that your loved one feels more loved, important, and understood. Also make maximum use of visual stimulation or cues. No doubt, vision is critical as it offers the broadest range of possibilities for stimulation. For people living with Alzheimer's, visual stimulation can involve light, color, shape, motion, or a combination of those elements. These visual stimuli may stimulate memory and improve mood. If your loved one's living with Alzheimer's disease, it is important to educate yourself in order to discover the keys to developing a more positive interaction. For in the words of Ben Franklin, an investment in knowledge always pays the best interest. In closing, thanks to my guest, Mal Allard. Mal?
Thank you.
Thank you. Great to have you on the program.
Thank you.
And as usual, thank you to you, our viewers, for watching Your Money, Your Life. My name is Ramsey Bahrawy, Building a Trust.